We will demonstrate in this video how to perform a transcranial color-coded Doppler sonography. A transcranial Doppler sonography is performed using a 2 MHz probe. You can choose the correct probe on this machine by pressing the probe button, as you can see, and then choosing the correct probe on the machine. You then choose the cranial mode by going into the cranial mode choice on the options. A full TCD examination may include examination of the transtemporal, the transforaminal, and the retromandibular windows, and may also include optic nerve sheath diameter measurement. We will start with the transtemporal window. The patient is lying supine, and the sonographer is standing by the patient's side or by the head end of the bed. The transtemporal window is the thinnest part of the temporal bone and is located anterior to the ear and above the zygomatic arch. With using the gel, the sonographer places the probe at 90 degrees with the probe marker facing anteriorly. On the machine, we will start with a depth of about 15 centimeters, looking initially for the contralateral bone. Once the contralateral bone has been identified, the sonographer will adjust the gain, looking for the characteristic pattern of the cerebral peduncles and the basal assistance. The sonographer will make tiny adjustments to the probe position to try to get the best picture. When this pattern is in the middle of the screen, the sonographer will readjust the depth to about 10 centimeters and will start to apply the color Doppler mode. The first vessel to identify will be the MCA, with the flow directed towards the probe and going towards the top of the screen. The ACA will be identified next, with the flow directed away from the probe. Flow in the PCA will be partially directed towards the probe in the P1 segment and then away from the probe from P2 segment onwards. Normally the MCA can be found at a depth of 30 to 65 millimeters, while the ACA and PCA can be found at 60 to 75 millimeters. The sonographer will then use the pulse wave Doppler mode, adjusting the sample volume to 5 millimeters. Sonographer will then move the cursor along the artery starting at a distal point. He will then sample the entire length at 5 millimeter intervals. For each segment, the sonographer will identify the highest flow velocity by adjusting the angle and adjusting the position of the probe. A normal TCD waveform in systole has a sharp upstroke that accelerates to a peak. We can then use the measurements to see the values for the systolic, diastolic, and mean flow velocities and the pulsatility index. The sonographer will then start doing the measurements, choosing the MCA. The sonographer will then start to trace the TCD waveform. And now you can see the measurements for the peak systolic and diastolic, mean, and the pulsatility index. For calculating the Lindegaard index, the sonographer will insonate the extracranial internal carotid artery using the retromandibular window. The sonographer will demonstrate the retromandibular window located under the chin at the angle of the jaw. The sonographer will then place the probe at the angle of the jaw, directing the probe superiorly and slightly medial. This vessel can be found at a depth of 45 to 50 millimeters, with blood flow directed away from the probe. It is important to differentiate the external carotid artery from the internal carotid artery. The external carotid is a high resistant vessel. The sonographer will then start doing the measurements on the ICA sample. As we have shown before, we will choose the ICA and go on to the measurements. The sonographer will then trace the TCD waveform. And now we can see the values for the pulsatility index and the time average maximum velocity, and we can use these values to calculate the Lindegaard index. For insufflation through the transforaminal window, the patient would be lying on their side with the neck flexed and their chin on their chest. The probe will be placed under the occipital protuberance. The probe is then directed cephalad towards the bridge of the nose. After applying the colored Doppler mode, the probe can be then directed to the right and the left to find the vertebral arteries, which can be found at a depth of 60 to 85 millimeters, whereas the basilar artery is found at 90 to 120 millimeters. The blood flow is directed away from the probe.